would encourage families to seek life-enhancing treatments rather than short-term solutions. Her quest is to reach as many moms and caregivers as possible through her books, journals, podcasts, and presentations. Dr. Catherine Murphy DENT Talk focuses on the power of listening to one's intuition. That's important. In our very logical and often systemized profession, the noise of the handpiece can often drown out the whisper of our own guidance system. Please help me welcome to the stage Dr. Catherine Murphy.
Thank you so much. Wow, to follow up her though, wow. I'm gonna just lay these across here. Okay. Here are the words that changed my career. Can you guys hear me? Okay. You're a geriatric mom who worries too much. Go home and enjoy your child. Some kids are just like that. Well, it was as if the last bit of energy that was in my fatigued new mommy body had been sucked up and out. And I was left just skin and skeleton with a bulging diaper bag. I went in to my son's pediatrician looking for answers for his noisy breathing. He was 7 days old. He wasn't sleeping. He was constantly eating. I would get done nursing him, and he'd be ready to nurse again. I was exhausted, and he was irritable. And I wanted to go home and enjoy being a new mom. I wanted to enjoy my sweet, adorable baby. I had wanted to be a mom. And I left with being told that some kids are just like that. Well, before I tell you more about my son's struggle, I'm gonna have you kind of look at your preference for GPS systems, okay? Guidance systems. A recent study found that 60% of American drivers rely on their GPS at least once a week. How many of you fall into that category? How many of you, though, double check those directions, pull out your nice old, paper map, or are you pretty trusting of it? Well, I will admit, especially for someplace new, like coming here to Houston, I'll type in my location and then I will trust it. I have nothing else to guide me because I haven't been here before. But areas that are familiar, well, I'm not as trusting, because then things start to feel familiar and I wonder should I listen to those directions or should I follow where I think this is the better way? So this is a very simple example of how I should myself. So what's shoulding yourself? It's making decisions based off what you're supposed to do. The clinical psychologist Clayton Burbeau coined this term of shoulding yourself, and it extends to actually making decisions based off what you feel other people think that you should be doing, right? So every time we make a decision based off what we should do instead of what we want to do, it's taking us a detour away from where we want to go. It's taking us away from our internal guidance system, our intuition. Our intuition will always lead us away from pain. It will lead us to joy. It will lead us to pleasure. But most of us spend our lives shooting ourselves every day. So when was my guidance the strongest? Well, for most people, it's when they're a child. For me, it was in college. And my college days were before cell phones. So my memories were on a standard camera roll. You had to go get the pictures developed, had the negatives. You could destroy them. My calls home were on Sundays using a calling card. So basically, it was freedom. And I let my guidance system guide me to the love of travel. And I spent a semester in Wollongong, Australia. I was a 15-minute walk away from the beach and an hour train ride to Sydney. It was incredible. My course load was heavy though, because I didn't really know I wanted to do that. And I was on track for pre-dent. So I had biochem and anatomy, but I was actually less stressed. Being further away from home, the shooting didn't come along with me for the ride. While I was also there studying on the other side of the world, I was introduced to new ideas of what you could do after school. And the idea that I should just go right to dental school was challenged. And I accepted that challenge. So I got back, and the grassroots, university-based outreach program caught my attention, called OKDV, Outreach Kenya Development Volunteers. When I told my parents and my grandparents that I, number one, wanted to take a gap year, and number two, I wanted to go on a mission to Kenya, well, there were hurdles, but I knew that this felt like the thing I needed to do. I had no doubt. They put out all the stops. They said, well, I'm sorry, but we're not going to help pay. And I said, well, I didn't ask you to help pay. So there I was my senior year in college, working 3 part-time jobs, full course load, and I am proud to say I made enough money for that trip, plus some extra bonus adventures on the way and on the way back. I got excellent grades, and I had so much fun. So then my gap year started, and that year was full of exhilarating experiences that got me to be able to be on this stage. So, it was 4 days after landing in Nairobi, Kenya's capital, and our car broke down. Yeah, so thankfully we were able to push it to a little vista point off the main road there. 3 days were spent fixing the car during the day, sleeping in the car at night. We took precautions, and it's also really glad we didn't have cell phones then, because my mom would have worried a lot. But I knew that we were going to get through this safely. I didn't doubt, I didn't fall into fear. I was being called there to help teach HIV/AIDS awareness and education and prevention. And this was just a little setback, a little bit of an adventure on the way to the main goal. So we got there, we got to my little town that we were going to be serving, Bungoma, that had a well for water and a long drop for your outdoor needs. So no running water, no electricity. And I reflect on these months often, because there, we didn't have distractions. We were there for the purpose to serve. And I realized that I was able to better serve that community, but also learn from myself. Because when we were done during the day, we did have a kerosene lamp to go through, because we would give quizzes before and after our presentations, so we could track to see how we were doing. But our kerosene lamps would also go out. So when the sun went down, we started to just simmer down for the evening. I had time to think and reflect. Well, the rest of the year was also full of amazing things where I got to be me, and I got to really embody the experiences that I was having. But then it was time to go back to things I should do, more so what others thought I should do. And that gap year was over. I'm very thankful I got into dental school, despite me actually telling them I had to actually write to all of them and take my application out and say I was going to reapply. But Indiana let me in. And then it was the autumn of 2001, my first semester. And I hope most of you have really great memories of dental school. But for those of you who maybe didn't, you can maybe understand. I was so lonely. I didn't know who to trust, who was really trying to be my friend, or who was really just looking to see if I had the latest test from the test bank. So then, there was a sophomore who wanted to show me the ways of dental school. And something didn't quite seem right with him, but I thought, I should give him a chance. Well, this is where my soul went empty. That night, I became that 1 in 5 women that became a victim of a date rape. And he became one of the 98% of rapists that never get reported. So this was critical to my future because it was actually more difficult for me to admit that my intuition was right and I should have listened to myself. It was easier for me to just go ahead and continue to make decisions on logic. I was going into a profession that's very logical. So I continued. It was just too painful. My years of dental school and orthodontic residency were full of health conditions and medications that I never thought I would need. But in 3 months, my scale and my clothes were showing 15 pounds that I had added. Caffeine was being consumed at every meal. My energy and my enthusiasm were drained. At that time, I thought taking time to relax and reflect was frivolous. I was here to become. I was here to do, not be. So even when I did go out and I wanted to enjoy things, my mind wandered to what I should be doing. What would be more productive of my time? And I blamed it on school. But really, it wasn't school. It was my own head. I didn't type in a destination where I wanted to go. So I let everyone else decide for me. I let them direct the course of my life and where I was going to go. Well, thankfully, I'm here now. Life is much better. It took years to really accept that I needed to listen to myself, to delve into some creativity, and really then decide to stop shooting myself, to determine my own destination. So I'm going to go back to those words that changed my career. You're a geriatric mom who worries too much. Go home and enjoy your child. Some kids are just like this. Well, I knew that it wasn't me that had to change. I didn't know what was wrong with my son. I didn't know at the time that it was going to change my career. All I knew is that shooting myself was one thing. Shooting my son and his future was another. Well, the shooting came from others. I should listen to the doctor. I should stop breastfeeding. I should wait and see. Well, that wasn't going to happen. So, the journey started when I took my son to an infant massage class. There, the pediatric physical therapist said, hey, can I show you some stretches for his neck? I said, sure, I obliged. At this time, we had cell phones, so I took videos so I could do them at home. Not really sure what this was going to do. But then I met with my lactation consultant, and I mentioned this to her, totally just in passing. And she said, well, how about you actually take him for a full evaluation from that physical therapist? Because maybe he has torticollis, which is the wry neck muscles causing the head to kind of tilt and rotate. And it can make nursing difficult. It can make sleeping difficult. It can just make tummy time just painful. So I did. At 6 weeks old, he started physical therapy. My conversations with the physical therapist helped guide my late night scrolling. Again, I still didn't quite know what I was looking for, but I was on those groups, I was searching, I was going to find answers. At 6 months old, my son started to have night terrors. Any parents in here have a child have a night terror? Well, may that never happen to anyone. Because what's a night terror? It's when a child is inconsolable. They're flailing, they're in fear, but still asleep. You try to hug them, and it can make it worse. So here I am, this new mama, looking for answers, supposed to have this son wanting to be held by me, but he's having these episodes during the night that I have to let him get through. So when we talked to the pediatrician, this time I was ignited with fury instead of passion to find the answer. I was furious because I was told, well, the good thing is your baby doesn't remember it, and they'll grow out of it around 4 or 5. And they went so far to say is, maybe you and your husband could just grab a beer while they get through it. Enough. This was supposed to be the top pediatrician practice in our area. I switched to a new practice solo practitioner with a more holistic view. Within walking into her office, the aroma, it smelled nice. And it was a dreary day. And I felt warmed and welcomed there. Well, within the first 10 seconds of Dr. Uzlak, our new pediatrician, walking into the room and holding our son, she said, what are you doing about his plagiocephaly? You see, plagiocephaly is when the head is a little bit misshapen. And it can be in result to that torticollis. The head being tilted and always wanting to be in the same direction as to not increase that muscle tension going to the side. So if any of you had a bad night's sleep at your hotel and you can kind of feel that in your neck, imagine that from the very moment you were born. Make you kind of irritable. So we were talking about the physical therapy. We started talking about his poor gut health. See, he had been put on antibiotics upon birth due to an infection I had developed in the hospital. We talked about his vitamin D3 levels. We talked about tummy time. And she talked about there might be some oral restrictions in there. There might be a tongue tie or a lip tie. Well, I started to make connections. His poor sleeping, his irritability, constantly nursing, his noisy breathing, mouth always open. And that was the connection. His mouth breathing. So that was the year 2017, but then any information that came across my inbox about mouth breathing or tethered oral tissues, I was there. I attended that course. 2017 is also the year that our American Dental Association defined our role in this sleep epidemic, our sleep-related breathing with children and adults that we should screen as part of our medical and dental history. It defined our role. Because as a mom, I was really proud of where I was going with my son and his health. But as a practitioner, I had some internal conflict. But this helped. Because I thought, how in the world can I change every part of my practice? How can I change the focus of me being here to fix crooked teeth to telling these parents that crooked teeth are really a symptom of many underlying causes? That was gonna take a lot. I was really good at just straightening teeth, but I wasn't quite sure how I was going to help these patients shift the entire focus and working with other professionals. But I also thought, well, how could I not? That night, I was comforting my son in the middle of the night. His room was dark and quiet. I was enjoying his cuddles and his much softer breathing. You know how those memories just pop up sometimes and you're not sure where, because they have been kind of stuffed down? Well, this memory of his mom's face popped into my head. She had brought her toddler to me with the chief concern of teeth grinding. She had just taken her child to the pediatric department next door. I ran the orthodontic department. And I assured her, don't worry, at this point there's nothing you and I can do. The child will just grow out of it. Oh, my eyes welled up. I realized I had told many parents the same thing that essentially the pediatrician had told me. Well, I vowed I couldn't do that. I couldn't do that again. And so I did. I changed. I realized this was information that my patients needed to know, and the public needed to know. But now, how are they going to let the public know? Well, the answer came when a dental nonprofit reached out to me called South Shore Skipping Stones. Their whole goal is for kids to skip the pain of tooth decay. And they wanted me to talk about my breastfeeding struggle. I said, sure. And I said, well, why me? And they said, well, you're a doctor, and you didn't get the support from breastfeeding. If it can happen to you, it can happen to anyone. You're going to show those expectant moms and those new moms how important it is to be an advocate for your child. So that talk, I made the promise that I would be there to support as many mamas as I could. So out of that, I created my book, my journals, my podcast, Dear Mama. Because our intuition will lead us away from pain, will lead us to love, will lead us to joy. It led me to being an advocate for my son and changing my entire focus of practice. So as I conclude, I'm going to challenge you again